Hello and namaste to all of you. This is Name-Shalu Singh from Department of Physiotherapy and Diagnostics from Jayoti Vidyapeeth Women's University. So today I'll be discussing with you about microalbuminuria test. So if your doctor believes that you are at a risk of kidney disease or kidney damage, it's likely that you had or will have microalbuminuria test. Now, the microalbuminuria test is a urine test that measures the amount of albumin in your urine. And albumin is a protein that your body uses for cell growth to help repair tissues, and it's normally present in blood. And a certain level of it is in your urine may be a sign of kidney damage. Your kidneys are responsible for removing waste products from the blood and regulating the water fluid levels in your body. So, healthy kidneys make sure that waste is filtered out from your body and that nutrients and the proteins that are essential to your health, such as albumin, stays in your body. And it's important to make sure your kidneys are functioning properly so that albumin remains in your blood. And if your kidneys have been damaged, that may not be able to keep albumin in your blood and will start to spill into your urine, which this occurs. When this occurs, you may experience a condition known as albuminuria. And albuminuria simply means that your urine contains albumin. So the albuminuria test, also known as albumin to creatinine ratio test or albumin urine test. So what is the purpose of basically the test? So if your doctor recommends a microalbuminuria test, and if you're at risk of kidney damage or if they suspect your kidney might be damaged, it's important for your doctor to test and diagnose you as an early as possible if your kidneys are damaged, and the treatment may delay or prevent kidney disease. And the two most common cause of kidney diseases are diabetes and hypertension or high blood pressure. So you may be ordered the microalbuminuria test if you have one of these conditions. Now, the purpose of microalbuminuria test is to measure the amount of albumin in urine, and the test is typically used in conjunction with creatinine test to provide an albumin to creatinine ratio. And the creatinine is a waste product of blood that your kidney should remove. And when kidney damage occurs, creatinine levels in urine decreases while albumin levels may increase. So often you need microalbuminuria test depending on whether you have any underlying conditions or whether you have symptoms of kidney damage. So early stage of kidney damage usually shows no signs or symptoms. However, if kidney damage is extensive, your urine may appear foamy, or you may experience swelling or edema in your hands, feet, abdomen, and face. So, in case of diabetes, it's recommended that people who have diabetes get an annual microalbuminuria test. And this is because diabetes can cause damage to kidneys, and a microalbuminuria test can be used to detect this damage. And if you have positive test results, you have diabetes. So the doctor should confirm that the results through additional testing over 3 to 6 month period. And if you confirm you have kidney damage, it will be doctor will be able to treat the kidney injury and help improve and maintain your kidney function. Second, there can be the case of high blood pressure. So if you have blood pressure, you may be screened for kidney damage using the microalbuminuria test. So high blood pressure can cause damage to the vessels of kidneys and resulting in the release of albumin into urine. So testing for albumin should occur at regular intervals. So what are the preparations for the test? So the microalbuminuria test is a simple urine test. So you can eat, drink normally before the test, and no special preparation is required for this test. So how is this test administered basically? There are several types of microalbuminuria tests that are available. Firstly is your random urine test. So you can take a random urine test at any time, and doctors often combine it with a creatinine test to improve the accuracy of the result. and you can have this test in any healthcare setting. So you'll collect the sample in a sterile cup and send it to laboratory for analysis. Secondly, there can be 24-hour urine test. For this test, you need to collect all your urine for a 24-hour period, and the provided container for urine collection that you must keep in the refrigerator. So once you have collected urine for 24 hours, you need to return the sample to your healthcare provider for a lab analysis. Lastly, there is a timed urine analysis. So if you're asked to provide urine sample first thing in the morning or after 4-hour period of not urinating, then once the lab reports the results, the doctor will be able to provide you with more information about the results, what they mean, and what are the risks for the test. So the microalbuminuria test only requires normal urination. So this test has no risk and you should not have any discomfort. So how will the results be read? So according to National Kidney Foundation, albuminuria is the presence of too much of albumin in urine, and microalbuminuria is the presence of a slightly high level of protein in urine, and microalbuminuria is the presence of very high level of albumin in urine each day. So the result of microalbuminuria test are measured as milligrams of protein leakage in your urine over 24 hours, and results generally indicate less than 30 mg of protein, which is normal, 30 to 300 mg of protein, which is known as microalbuminuria, and it may indicate early kidney disease. More than 300 mg of protein, known as macroalbuminuria, and which is indicative of more advanced kidney disease. Several temporary factors that can cause higher than normal urinary microalbumin results, such as in case of your blood in your urine or hematuria, a fever, recent vigorous exercise, dehydration, a urinary tract infection. So certain medications can also affect albumin level in your urine. Examples such as acetazolamide, antibiotics including aminoglycoside, cephalosporins, penicillin, polymyxin B, and sulfonamide. Antifungal medications including amphoteric B and glycefluven, and lithium, which is medication people use to treat bipolar disorder, non-steroidal anti-inflammatory drugs like aspirin and ibuprofen and naproxen, penicillamine, which is medication people use in past to treat rheumatoid arthritis, phenazopyridine, which is medication people use to treat urinary tract pain, tolbutamide, which is medication people use to treat diabetes. So once your results have been processed, doctors may want to test you for urine again if test has abnormal results, and if necessary, doctor will recommend you with the best treatment options for the kidney damage and its underlying causes. So measuring the amount of albumin in urine is important for detecting the presence of kidney damage, and the kidney damage can lead to kidney disease or failure. So if kidney failure occurs, dialysis is often necessary. By identifying kidney damage and before it results, kidney failure, your doctor can slow the progression of any further damage and help preserve your kidney function over the long terms. So